Treatment for children in a vegetative state. Patients in a persistent vegetative state lack awareness of their own behaviors and their surroundings. There is hope for a recovery. Our treatment can restore awareness in some patients with severe brain damage within a month.
In our study, we treated 2 adult patients with severe brain damage who were in vegetative states, one persistent, one permanent, both worse than minimally conscious state or locked-in syndrome. Encouragingly, both patients regained consciousness. However, some non-vegetative state symptoms, such as aphasia and paralysis of the affected limb, remain. We estimate the potential for good outcomes and better recovery in younger patients, and our research is now focused on treating children in vegetative states, minimally conscious states, or locked-in syndrome.
Case 1 is a 64-year-old Chinese female living in Chongqing, China. Diagnosed with multiple cerebral infarcts and progressive brain atrophy at the age of 51, brain bleeding, drain out 250 cubic centimeters old bloody liquid at 53 years old, Alzheimer's disease at about 58, permanent vegetative state for 4 years. Her family tried many treatments to no avail. Before our treatment, in addition to a vegetative state, the patient also exhibited cachexia, which included fixed stare, extreme muscle atrophy, significant weight loss, and severe rigidity in her trunk and limbs. 6 days after receiving our treatment in early May 2015, her consciousness has recovered well. Her eyes can look around. Her face has returned to normal. Her neck is soft, and the rigidity of her limbs has been reduced by about 90%. She can follow our verbal instructions and open her mouth to eat. Weight gain is about 10 kilograms. Her body and limbs are still unable to move voluntarily. Case 2 is a 44-year-old Chinese male living in Harbin, China. On December 19, 2015, he was diagnosed with brain AVM rupture, herniation, and he remained in a coma after the operation. Later, he transitioned into a persistent vegetative state. In July 2016, CT examination showed severe atrophy or necrosis of the left temporal lobe, left frontal lobe, and left parietal lobe, and mild atrophy of the right frontal lobe. Phlegm removal at least 5 times a day. One of the best hospitals in China tried everything possible with no effect. The family sent his medical records to the military's best hospital for consultation. Experts said his brain was severely damaged and he would not be able to recover even if he was sent to the United States for treatment. On October 25, 2016, we started our treatment. He regained consciousness after 11 days. 3 days after treatment, the nursing assistant said the fingers were moving, but we were not sure. "11 days after treatment, his mental state reached the best level since he became ill. When a family member was around, the patient moved his left hand a little. By looking at his facial expressions, we knew that he wanted to reach out and touch the person. 15 days after treatment, feeding ice cream, the family is full of joy. 23 days after treatment, smiling for about 10 seconds, the family is extremely happy. 26 days after treatment, his left hand can move toys. 29 days after treatment, rapid progress is being made. 40 days after treatment, he insists on taking the last toy, indicating that the brain consciousness has recovered very well.
好了，给我了，把那盒子给我了。对，盒子给我了。还有呢。
Our study shows promising results for treating patients in vegetative states, suggesting this treatment could be a valuable tool. If you would like to learn more about this ongoing research, please visit our website or contact us.